When considering treatments for metastatic colorectal cancer, especially in later stage settings, patients and physicians have to balance, the survival gains from these therapies with adverse events and impacts on quality of life, which can be quite profound. And so, the opinions of what is most important is very important to consider, but may also differ between patients and physicians. So this study was conducted to understand the preferences of patients and physicians through survey exercises. Some of the key takeaways were that both patients and physicians appear to prefer oral only therapies versus treatments that involved addition of intravenous regimens to oral regimens. And patients were actually willing to make compromises even in overall survival gains to achieve that oral only treatments. Another important takeaway was that patients were willing to forego about 3.3 months of overall survival to achieve like reduction in fatigue, which is a prominent side effect, and to also forego of overall survival for about 2.2 months, for if able to decrease the chance of neutropenia by about 55%. When you compare to the physicians, on the other hand, the willingness to make those overall survival adjustments was much narrower, which indicates that for patients, these side effects are quite important considerations, and oftentimes they are willing to make compromises even in survival gains to be able to have that quality of life. We also found that among the side effects itself, there were differences in the type of side effects that were important for the patients versus the physicians. For patients, fatigue was the one of the most important adverse event attribute, whereas for the physicians, it was neutropenia. So overall, these findings highlight the complexity of the treatment choices in late line metastatic CRC, and highlight the importance of considering these differing perspectives between patients and physicians, and emphasizing the need to consider all these multiple factors in decision making.